Thanks, Devin. And according to the CDC, the estimated annual death rate among hospitalized patients for blastomycosis usually ranges between 8 and 10%, although it's increased to 17% in 2021. Here to tell us a little bit more about blastomycosis is Nurse Christina Paris. Thanks for joining us this morning.
Hi, good morning. I'm glad to be here.
Yeah, it is certainly something we've been talking about. I know we mentioned it in a news story last week, and that's when you were messaging me and kind of prompted this Nursing the North today.
Right. Thought we'd do a deeper dive since you just kind of covered it a little.
Exactly. Yeah. Well, you know, clear the air here. So what is blastomycosis?
So blastomycosis is a mold. It's a fungus. So it's a mold, but it releases spores, you know, fungal spores, and to the air, and it causes a lot of respiratory issues. And so places like up north where you've got a lot of underbrush and there will be wet, moist areas like the leaves start to decay and trees will start to decay and break down. So if you're in those areas, digging up that dirt or clearing it puts you at risk for contracting the spores that will float up into the air.
Interesting. So that forms outside like that.
Right. Yep. And so it's kind of in the soil and as things break down.
So are there any recognizable symptoms of blastomycosis in case we think we've gotten it?
There are. And I mean, the symptoms are very similar to a lot of symptoms that we have around here. So you're going to have, you know, fever, cough, feel short of breath, maybe have night sweats, muscle aches, joint pain, weight loss. You might have some chest or rib pain because, again, it causes a lung infection. Feeling kind of fatigued. You can develop a type of pneumonia. You know, we have COVID pneumonia and we have this kind of pneumonia as well. And sometimes people will get skin lesions or skin infections as well due to this. And it can take anywhere from 3 weeks to 3 months to really develop these symptoms.
Oh, wow.
And the key thing is you want to kind of, whenever you're sick, sort of think about what have I been doing lately, you know. I'll have patients where I'll ask them, have you been around people who are sick? Nope, I don't go anywhere, I stay home. But, you know, were you working out in the yard? Are you clearing a field? And pets. Pets are really susceptible to this. And I hear more about it affecting dogs and pets, and it hits them really hard. And usually they don't make it. Just really sad, yeah, because they go and they'll follow a mouse or something, and they're digging and rooting into the.
That's what dogs do.
And so they're getting all the spores. Well, dogs can pass it to humans through bites. You know, if they bite you, but and veterinarians are at higher risk, and there isn't a vaccine for this. So yeah, you really want to be careful. I've only encountered one patient who had it, and it was a horrible lung infection, and it took a very long time to heal.
Okay, so you'll definitely be not feeling 100% if you've got it.
Right, yeah.
Okay, well that's good to know.
Difficulty breathing for sure.
Okay, well, how is it treated since, you know, so there's no vaccine for it?
Right, so you would go, of course, talk to your doctor, get a physical exam, share symptoms, and if you think that you may have been exposed, you were working out in the field, you were clear cutting, you're in forestry, fishing, hunting, camping, that kind of thing.
Makes sense.
Yeah, you want to bring those things up to the doctor. They can test for the blastomycosis through sputum. They can look under a microscope or even do blood tests. And then it's treated with antifungal medications.
Oh, well, that's good.
Orally, yeah.
So then it can be cleared up pretty quick then. There
is a treatment for it, and,
well, that's good.
but you want to take it. It's kind of a longer treatment. Similar to like tuberculosis, although it's not as severe as tuberculosis, but it's still a significant lung injury.
Well, you know, speaking of people who are out digging and poking around in the woods, you mentioned forestry and, you know, any sort of fishing, I suppose, as well. Yeah, I'll have to ask my dad if he ever came across any blastomycosis.
Yeah.
You know, and walking through the woods all the time.
And we do hear about it every now and then. Again, usually it's a dog that has gotten into the deep woods and rooted up the soil there. But yeah.
Well, thanks for coming on and clarifying this. I appreciate it. It's certainly an interesting thing to think about when you're out and about in the woods.
Yeah, take care and watch those pets and watch yourselves too.
All right, well, thanks for the time this morning, Nurse Christina.
Yeah.
We'll be right back with a look at your What's Trending this morning with Devin. Take care.